to give a talk to this group. I'm obviously, as per the title, going to talk about biobanking and pathology at a sort of a high overview kind of level. And of course, the subtitle, as you can see, is fairly cryptic, but and I'll explain that as we go through the talk. And the first part of the explanation is this slide here, which I think certainly isn't cryptic. I think the message, at least the superficial message, is very clear. This is just a snapshot of some of the public perception as illustrated in the Canadian press over the last few years as what pathology is, what it does, and how well we do it. And as you can see from all the titles, and I'm sure you guys have seen many of these articles and papers over the last few years, the superficial message is very obvious. I mean, as a pathologist, I sort of recoil from words like botched and poor and disgraced and mistake and error. But that's actually what the public is reading about pathology. That's what it hears that we do as a discipline. On the right, you can see that the situation, I think, is so bad that on the day that Canada beat Russia in the Olympics, the BC version of the Globe and Mail had that as the front page on the hard paper copy, but in the Ontario version, instead had on the front page that there was more errors going on in pathology. So that even dumped beating Russia onto the third page. And not only was that incredible, I think, in terms of the interest in the press in propagating this concept, but that particular story at the time of the Olympics was, in fact, around mistakes or error or whatever was actually happening, but it wasn't actually pathology. It was actually another discipline. But the article, like all of these articles, starts off with more mistakes in pathology and errors, and then you turn to the next page. And really the stories behind them are, most of them, all about the human side of medicine, which is that we're all human and people make mistakes and we strive to improve. And so I think it's a very important message on the surface that the public thinks that pathologists make errors. They don't think pathologists make diagnoses that improve care. And of course, behind all this, and I'm just dwelling on this slide because it's very important, behind all this is our response as a discipline. And of course, the response has generally been, we're human, we try hard, we work hard, we know there's errors in the system. If you give us more resources or direct more resources to the discipline, we'll fix it and we'll do a better job. And I think that's certainly a reasonable response, but I think there's a couple of things wrong with it. The first thing that's wrong with the response is it's saying there are lots of massive problems in pathology, not medicine is a human art and there will be errors, and the issue is how do you minimize those and learn and improve. The second issue behind that response, but I'm not saying it's a bad response, I think that's just part of the caution behind it, but the second issue behind that response is it doesn't really provide an argument why somebody should provide more resources to pathology and the discipline so that we can fix and improve. And the reason I say it doesn't provide resources because we're all aware that we have a public and a political and a governing system in our country and in most Western countries where public opinion bears on politicians who are generally the decision makers. And I think there are very few of us as individuals and certainly as politicians who get excited about trying to make decisions that direct resources to fix major problems in infrastructure that are a problem. You don't want your name associated with issues and errors and problems. What people get excited about is a good news story, something that's new, better, and will improve the system and offer something brand new that the public wants. So I think what we need to project is not we would fix it if we have more resources, which is absolutely true, because pathology has been desperately under-resourced in the last 20 years in Canada, and that's another story which I've certainly lived through. But the real story is how do we create a better message about what pathology as a discipline does, what it enables, and what it does to improve healthcare. And of course, if we were going to create that story, what would it be? It would be an activity that's central to what we do, and it'd be an activity that the public has heard something about, And it would be an activity that when the public is asked, is this something you would like to be involved in or do you think it's a good idea? 95% would say yes, and a couple of percent would say no, and that would be the story. So what is that? It's biobanking. Biobanking is what? The activity that's central to pathology. It's something we do. It's something that's integrated into practice, and the pathology is a discipline or cross-lab medicine involves handling biospecimens and making decisions and triaging those between one track, which is to provide the best diagnosis and care for that individual, and the other track is to generate a mechanism so that it can be used to generate knowledge and improve care. So we do that, but we sure don't project that as central to the mission of pathology to the public. So what I'm going to do in the rest of the talk, having dwelt on the first slide, because it is the most important, I'm going to return to that at the end and explain what I think is involved by a partnership. But before I get there, I'm going to spend a few moments talking about biobanks, their definitions, spectrum, and values. I'm going to talk about some of the issues in the biobanking world. Then I'm going to talk about some of the solutions which we in BC have been major leaders in trying to propagate and develop, but also partners elsewhere and internationally. And then finally, I'm going to return to this perspective on pathology and what we're doing here in BC. So, just very briefly, what are biobanks? A biobank is a collection of biospecimens and health information. Why are they important? Biobanks sit in the middle of this cycle to better health, whereby people, a subset become patients, a subset of patients become generous donors of their tissues, their biospecimens, and their health information, so that that can be used by health research to generate knowledge that creates better care and converts patients back to people again. And biobanks, or the discipline of biobanking, is the activity that engages potential donors and makes it possible for their biospecimens and their data to be appropriately and good quality and the right kind of materials and the right kind of cases moved from the healthcare arena to the research arena, used appropriately in research, and then to complete the cycle to better health. The third point about biobanks, and I think people get very confused and hung up on biobanks and what they are. People come at it like you come at the word car or automobile, thinking, superficially there's one kind, but obviously under the hood there's a tremendous variety of technologies, mechanisms. They all move people from A to B or items from A to B, but they have different purposes and different designs and different mandates. And the same is true of biobanks. Biobanks are just like tools in a workshop. Biobanks are tools in the workshop of research. So just as for research to answer a question, you'll choose specific tools in a workshop, you'll go in and you won't just grab a screwdriver, you'll look at the head and choose a Robertson number 2 head. Same thing with a biobank. If you want to answer questions in research, you design your experiment and you design your biobank and your resource to answer those questions. You might design it very broadly so it can answer the first question and subsequent questions, or you might design it so it's available to answer a spectrum of questions from different areas, but designed it is. So there is a spectrum of biobanks, and there is just a very simple kind of list of some of the terms people use to divide certain high-level categories of biobanks, but there are a wide variety as there are research approaches, participants, and the focus of the research that the biobank is designed to support. So to give you just one of many examples, this is a biobank that I direct and organize for the BC Cancer Agency. It's a standard kind of biobank with several facets to it. It engages patients who are making that journey from people through the clinic and back to people again, obtains consent, appropriate biospecimens, and it harvests those materials and it makes them available for research. And things that distinguish this kind of biobank is it's a multi-user biobank. It's got SOP-driven processes behind everything that it does so that we know exactly how materials have transferred from the clinic to research. We have invested in an expert team to run it, and it's open access, so the best science can apply to this resource and if they're qualified with the appropriate qualifications in the ethics and the scientific arena, they can access the resource to make progress in cancer research. So what are the kind of operations? Well, we have three kind of general areas of operations. The first is just passive accrual, supporting retrospective questions and questions where you want to select triple negative breast cancers, and to study those, well, you've got to have 1,000 breast cancers if you want to select 50 high-quality triple negatives and answer a particular question. So that's our retrospective passive collection. We have a stock, we maintain, we accrue, and we have an access process to that. The second aspect of the core operations, which is different from the retrospective passive collection, is that we also have active protocol-driven accrual. So we are a mechanism where a research question or program can come to us and say, we got a question, but we need to prospectively collect this kind of sample and this kind of case to answer a question. So that's a study-based prospective protocol. So because we have an organization called a tumor tissue repository that already operates in the clinical arena and has a passive mechanism, we can deliver prospective protocols. And here is just one of many examples of the research the TTR supported in the last few years. This was a study initiated by Rob Holt's group at the Genome Sciences. He came to our passive collection, wanted to study the immune response in colorectal cancer. He's a genome guy, so we select an appropriate cohort of colorectal tumors. They start studying them. They discover these bacterial sequences emerging out of the data that they were trying to distill T-cell receptor data from, decided this was an unusual finding, and that then turned into a completely new discovery, which was the finding of a particular subset of Fusobacterium present in association with colorectal cancer. That became a genome research paper and was nominated as one of the top 10 medical discoveries in 2011 by Time magazine. It's a discovery and observation. It hasn't been validated. There's lots more to do. So guess what? The TTR is now involved in prospective protocol-driven collection to drive the next questions emerging out of that discovery. And the third aspect of the TTR is to provide not just a biobank support service, but we support other kinds of biobanking, both within our center and beyond in BC. And also our mandate is to drive the area of biospecimen science, not just to do our own projects. So we are engaged in and drive all of these other entities that we think are necessary to address the issues of biobanking at multiple levels. And just finally, just so you don't think it's just something that a stamp collection stuff goes in and it goes out and we don't look at it, we think all the time about our performance, our efficiency, the costing, our accrual numbers, the quality of our specimens. The TTR is biobank number 2 in that Trans-Canada survey, showing that in an external survey we rank amongst the top biobanks in terms of quality of material that we can provide to researchers. And we think very hard about not just collecting in, but how do we get our material used? So we try to promote and support studies, export samples, and to see the results of our infrastructure in successful grants awarded or high-impact papers generated. So let's go back to why biobank. I've described the spectrum of biobanking. I've given you one sort of multi-user, poly-user biobank example. What is the value of biobanking? So the value depends on your perspective. So there are many perspectives on biobanking. One is science. Science sees biobanks as a fuel to fuel the ideas and generate research data. Clinicians like us view biobanks as the thing that made it possible for me to order HER2, ER, P53, P63 stains to make a better diagnosis on a daily basis in my work as a breast cancer pathologist. Society sees biobanks as an engine of wealth, as a newfangled way to generate IP and jobs and industry and wealth for provinces or sectors like the pharma sector. And then you have people, the people at the end. The people and the public actually see biobanking quite differently from those other three entities. So why do they see it differently? Well, they see biobanking differently because when we walk out of our daily lives as pathologists or scientists and researchers, and we engage the public about what we do. What do we do? Well, I'm a breast pathologist. I have a 20-year-old research program in my lab that's really interested in understanding the mechanism of invasion from pre-invasive DCIS to invasive cancer. We began microdissecting samples years ago. We profiled these using fancy genomic technologies of the day. We identified genes that were really exciting and differentially expressed. We focused on this gene, S100A7. We profiled its pattern of expression. We went into cell lines and transgenic mice, and we identified the mechanism of action in the breast cancer cell where it interacts with a protein called JAB1 and tweaks a bunch of cell survival and signaling pathways. And now we're very interested in it as a biomarker of downregulation of the estrogen receptor in response to the cytokine oncostatin M. So when I go to the public and tell that story and say, will you support my research, what do you think the public does? Well, I'm looking out at the audience and I could see people's eyes glaze over as I talked about the thing that I'm passionate about. This is just my little corner of research that I'm interested in. But what a lousy message. Why is it a lousy message? It's complex, it's uninterpretable, I use lots of acronyms, and most of all, when I described all this, I was passionate about this, but this might not be relevant to the other 99% of cancer patients that I might be approaching. So I might approach 100 people with cancer, but I tell only one of them, you're really special because you've got the kind of cancer that I want to study. Will you be engaged in my research and will you support it? Or we don't go and tell everybody, we're interested in all your cancers. We're interested in studying all of these. You're all special. It's all important. Will you support us to work broadly on the whole thing? So that's obviously the message that biobanking gives. Biobanking is research. It's research infrastructure. When we approach the public, what do you think our response is? They say, boy, how can I give back? What an opportunity. 90% choose to participate. And they get the message that we not only care for them, we're striving to solve all of their problems. And last and most important of all, instead of the message, you got a problem, we'll give